There we go, Zach. A very good morning to you. Thanks for joining us for our event today, focused on the important topic of net zero NHS, delivered to you, our valued audience, by National Health. A huge welcome to new faces joining for the first time, and hello to those of you who we see every 2 months. The National Health Executive is always keen to deliver content which inspires innovation on the platform long after the event has finished. Today will be packed with opportunities to network and acquire more current sector knowledge. So I hope you're looking forward to what we've got in store. And we must thank the industry leaders and experts who have taken time out to join us to share their high quality insights. Due to the standard of content that will be shared on our NHE365 platform, it's worth me pointing out that all the content is CPD certified. For every hour of content you watch live, you'll earn 1 CPD point. To receive your certificate, please email the NHE team at marketing@cognitivepublishing.com. That's marketing@cognitivepublishing.com, and they'll sort it out for you. We also provide the opportunity to give back through some friendly competition. Whilst learning today, our gamification tools will be active. Score points by engaging with the platform's different elements. Join a live session, there's 50 points earned. Make a connection with another delegate on the platform, 100 points. Ask a question in the session or engage with one of our exhibitors in the digital marketplace, another 50. You get the gist. At the end of the event, those who finish in first, second, and third places respectively will have 250, 150, and £100 to donate to a charity of their choice. Or you can receive this in Amazon vouchers. You can only be in with a chance of winning, of course, by engaging with all of the great content we have to share with you and the other delegates here. So there's a bit of background. Let's move to the focus of today. Back in 2020, the NHS announced its ambitions to become the world's first net zero health service by 2040. COP26 supported this further, with all UK health services committing to becoming net zero and building climate resilience through the COP26 health programme. So what does this mean for the NHS? Determining how best to tackle issues like net zero, biodiversity and climate resilience requires open engagement amongst all stakeholders. Implementing the first zero-emission ambulance fleet in the world, carbon reduction plans based on the social value model for the supply chain, and the £330 million investment in smart technology and low-carbon hospitals. We'll talk about the success of our NHS over the past years and what's being done to reach the ambitious NHS net zero targets. These strategies will be key themes in today's conversations. We also have great networking opportunities throughout the day that can be accessed via the speed networking function, and I encourage you all to collaborate with your colleagues as another great source of education. This plays a vital part in the community we're growing to extend the reach of knowledge and connections shared today, which can be accessed at any time to work with your busy schedules. Also on the NHE365 platform, access to a wealth of resources on our demand content alongside the digital marketplace, providing valuable expertise for you and your teams to digest at your leisure. Finally, feel free to share your thoughts and experiences today across social media using the hashtag NHE365, that's NHE365. So with the scene set, let's get cracking with our first panel discussion on NHS estates. The NHS estate and its accompanying facility services account for 15% of total carbon emissions, including primary care, trust estates and private finance projects. To work towards achieving net zero NHS targets, healthcare organisations must commit to upgrading and building new net zero facilities that consider energy consumption, waste, heating, lighting, smart technology, and even the construction and maintenance teams that maintain and upgrade healthcare estates and much more. So opening the conversation for us today, I'd like to welcome Esther Ukala, Environmental Compliance Manager at NHS Property. Esther will be discussing the impacts of climate change on NHS Estate and plans to reduce future risks and improve resilience in a warming world. With the rise in temperatures and shifts in weather patterns, we all know that adapting to climate change is imperative. So let's start off today by hearing from Esther.
Good morning. Firstly, I'd like to thank you for the opportunity of being a keynote speaker on this event. My name is Esther Ukala, and I'm the Environmental Compliance Manager here at NHS Property Services. So NHSPS, for those who are not aware of who we are, was established in 2013. We own and manage around 10% of the NHS estate with an asset value of around 3.8 billion. We have over 5,000 colleagues working within the company. And our main goal as an organization is to enable the NHS to provide that excellent patient care through our estate and facilities management services. One of our aims within our team is to help combat climate change and reduce the negative environmental impact generated through our business activities. My topic today is on climate adaptation, which comes under the climate change umbrella. So we'll be looking at what it is and what we as an organization are doing about it. I think it's fair to say climate change is one of the hottest topics in the world right now, no pun intended. It's one of the global risks that we are facing with major impacts on our society, our economy, and indeed our health and well-being. What's not well understood, however, is that there are multiple facets to this subject. Climate change covers mitigation. So these are the actions we need to take to slow global warming, e.g. the carbon management, net zero carbon campaigns, scope 1, 2, and 3 emissions reduction and control. There is already a great deal being done, both within our own organization and nationally in respect to this. And I think that's why most people are familiar with that aspect of the subject. Less common, however, is the adaptation side of things, recognizing that climate change is already occurring and we need to put in place the measures to help us cope with the impact and manage its associated risks. So how climate change affects NHSPS? We know that there's already been gradual changes in weather patterns and that our winters are getting warmer and wetter, while our summers are getting hotter and drier. But let's not forget the extreme weather events too. For example, flooding, overheating, storms, freeze and thaw spells, and the fact that these are set to increase in both severity and in frequency. These all have a tremendous effect on not only our buildings, but our ability to provide that continued service to the NHS. It affects our performance, the performance of our buildings, their structural integrity, the indoor conditions of our buildings too, particularly where heat waves are concerned. It is predicted that these will become more severe and will last even longer. And so will our buildings remain fit for purpose in such instances? Bearing in mind that they're there to cater for the most vulnerable within our community. There will also be an increase in running costs and maintenance cycle. Secondly, it affects our business performance, insurance premiums, property value, even our business continuity. And thirdly, it affects our brand and stakeholder engagement, our corporate social responsibility, our reputation, and has a snowball effect on our customers and suppliers too. So the big question, what are we doing to adapt? So we are going to take a strategic approach to this. We believe that to adequately address the issue, we need to gain a deeper understanding of how climate change affects our estate and our services. To do that, we need to carry out a climate-related risk assessment, which will identify which aspects of our organization are vulnerable to what risks. This looks not only at the physical risks that affect our infrastructure, but also the ability of our services and processes to transition to a low carbon economy. It will look at the impact over a stretched time horizon to really understand that long-term view. As recommended by the Task Force on Climate-Related Financial Disclosure, the process will also be scenario-based and be centered around understanding the financial impact climate change has on our organization, taking into consideration our customers and our supply chain. Based on the results, we will then have the knowledge and information that we need to build in adaptation measures as part of our future financial planning. Having that level of information will help prioritize and guide our efforts when it comes to what solutions we need to put in place, not just for our existing portfolio, but on our new builds, new processes, new systems too. Having these measures in at the design stage will yield more benefit and save us time and money in the long run. This is the strategy on what we have got planned. But that's not to say we haven't done anything yet. In 2021, we undertook a preliminary risk assessment of such kind. This was to identify risks at 300 of our sites, predominantly buildings from the late 70s, 80s, and 90s. We mapped them against the climate-related risks, and bearing in mind that these 300 sites all have patient care services operating 24/7, so the possible impact is quite great. We assessed the risk based on present day, 2040, 2100 time horizons, using several global warming scenarios such as best case scenario and worst case scenario. So 4 degrees Celsius increase, the 2 degrees Celsius increase, and the best case scenario of 1.5 degree cap. The risk factors we analysed were heat stress, wind, precipitation, coastal flooding, and drought. One of the key findings that came out of this risk assessment work that we did was with the increase in wind patterns, there was a really big threat to our sites. With tornadoes and storms expected to increase, there will be some degree of property damage. A more comprehensive climate-related risk assessment is due to be undertaken shortly. The aim is to widen our scope to include other factors, e.g. extreme weather occurrences, flash floods, surface water flooding, and to really bring into focus the practical measures that we can undertake to increase our resilience and the resilience of our buildings. In addition to this, we've established our position on climate change and adaptation through a clearly defined adaptation policy currently working its way through senior management sign-off. We've also incorporated adaptation as part of our disaster risk management through our business continuity planning that includes our preventative and emergency recovery measures. We've started to collate information on climate-related incidents so as to build a picture of how and where these affect us the most. We've continued with the resourcing and implementation of energy efficient measures through the various programs and projects carried out across our estate. We've also begun exploring nature-based solutions, so things like the ecosystem-based approaches, green infrastructure, and natural water retention measures. We've established links on collaboration platforms within the wider NHS to really start to share ideas and best practice. And last but not least, we've really been working hard on various related campaigns to increase the climate change awareness amongst our colleagues, recognizing that that's one of the ways that we can truly influence behavior and change in culture. Shortly, we will be launching our Green Plan, which contains more information on all of the initiatives that we'll be undertaking and that are geared up to help us get to net zero. So please keep an eye out on this on our Greener NHS page. Thank you so much for having me. And if you've got any more information on this subject or any other subjects related to this, please visit our website and follow us on our social media site. Thank you.
Well, our thanks to Esther for opening up the conference today and leading us so seamlessly to our first panel on NHS estates. I think we get the most out of these debates when they're a conversation, with you included in that dialogue. So please do use the Q&A function that you'll see on the bottom of your screen, and I'll pose some audience questions once we get going. So let me introduce you to our guests today. We have Ashley Seymour, Regional Development Director at Assura, Alison Foster, Programme Director, Building Berkshire Together at the Royal Berkshire Hospital, and Cameron Hawkins, Head of Energy and Environment at NHS Property. This is our first discussion today, so welcome. We've got a full house in terms of guests. Great to have you all with us. Esther, I think, did a fantastic job of setting the scene for us and asking what we're all doing to adapt. So if I may, let's start off with you, Ashley. You're leading on Assura's first net zero carbon development, been a key contributor to Assura's net zero design guide. Can you start us off by explaining what you're doing and how it's going? £10 million question.
Yes, absolutely. Well, from our perspective, the first thing, it's a bit of a learning curve, to be quite honest, for starters. So we've been working on it for about a year now. But the first thing we've done is become a member of the UK GBC, so the Green Building Council. And so we're a signatory to their commitment, which involves us taking leadership action, it involves us disclosing our annual performance data, and then acting to implement a decarbonisation roadmap and a number of other things. So the first thing we've done is learn and take guidance from them, and then we've just take the next step to take for us is to finalise this the design guide. So we've been working with our consultants to produce a guide that's easy to use for our consultants and architects and all the other rest of the team to help them design net zero carbon buildings.
I think that key word you use there is learning, Ashley. It's a very steep learning curve, I think, for everybody involved in this now. Cameron, let's move on to you. You joined NHSPS at the end of 2018 to lead the newly formed Energy and Environment team. Give us a sense of your learnings and progress that you've made over the last 4 years and how you're doing reducing energy consumption and indeed emissions.
It's been a really interesting one for us. I was lucky enough in some regards to come in with a bit of a clean slate, like it sounds like Ashley's got, and in terms of being able to come in and actually try and work out where we are and what we were doing. So over sort of the last 3 years, we've been going through what we've called our enabling phase. So we ended up coming up with 200 odd actions that were under 11 key deliverables, etc., like that, covering everything from data to compliance to transport and environmental compliance. And so I think what's been really interesting over the last few years is the amount of enthusiasm that people now have for this topic, and interest that people have in this topic. But in terms of there's that knowledge gap that I think there's really in place. So a bit like Ashley is what I had mentioned, is in terms of we're really focused on getting the right systems and processes in place. So that if there is people out there that want to do something, then we've been able to enable them to go through and deliver on that. And whether that's been accessing energy data, whether that's been accessing sustainability data, right through to our construction teams in terms of how do we put a green roof in, or how do we not put a gas boiler in, and getting all those sorts of elements together and really trying to work out the nitty gritty of it to make it as simple as possible for them. So we've done well over £14 million worth of LED installations. So now we've been able to work out how you do supply chain, you worked out how to do health and safety, permit to works, after hours access, all of those sorts of things we've now been able to establish. So if somebody else wants to pick up that project, then they can go through and do that. And it's now been really simplified. So it's led us to about £23 million worth of energy savings, reduction of carbon footprint of about 15%. And been able to establish an environmental management system to kind of help really reduce the likelihood and any impact that an environmental incident might happen. So really successful, but I think we're only really just scratching the surface on it now.
Oh, I think you're absolutely right. It's amazing, isn't it, that here in 2022, we're just embracing all this. I know you've been doing it for a while as well, but I mean, in terms of where we are that now we've suddenly realised that this needs doing, and it needs doing urgently. Ali, I like the fact that you've worked for the NHS for the best part of 3 decades. You don't look old enough to have done 3 decades, saying, and that you started off as a mental health nurse and you worked your way through clinical and operational management roles. And now you find yourself trust lead on achieving net zero carbon and program director of Building Berkshire together. I mean, that's quite a resume. How does your experience in the NHS help with what you're trying to achieve now?
Well, the biggest I guess, tool in the armory is engagement and working with teams. So that's really paid off. I took on the role as lead for Net Zero in August, and we'd done some work, but during the pandemic, it had slowed down. And what we did was we linked with our local partners, anchor institutions, so the university and the local council in Reading and also in Wokingham, but discovered that we've got in Reading the largest concentration of climate change experts in the world globally. So why wouldn't we use them? But apparently, yes, that colour that you see on Netflix of the blues and reds showing climate change, that's come from Reading. Just a shout out to the university there. But so we set out a plan in line with the NHS to achieve net zero by 2040. But on that journey, us and the board, actually, we've got a huge number of carbon champions, volunteer champions in the organisation. Thought, well, the university are going 2030 and the council are going 2030. Should we not push ourselves? So we have now been redrafting our plan, and we are about to launch a plan for net zero for 2030 to be more ambitious. Now, part of that will be because we're on the new hospitals programme, so we are hoping to integrate some of the work that we're going to do there between now and 2030 in our building and our construction to net zero. But we've done a lot already. We've done a de-steaming project we invested £9 million in, and that's a national exemplar in it's going to the NHS EI board in July. So we've been doing a lot, and I think a lot of that goes to the volunteer and the enthusiasm of the staff we've got in the organisation, but also reaching out to the community and working with our local anchor institutions. So yeah, it's been good.
We'll talk about collaboration in a minute, but collaboration is always a theme that comes out of all of these conferences, whether it's NHS we're doing or rail or public sector. Collaboration is so important, but we'll save that for a little bit later. Ashley, what does NZC, net zero carbon, mean to you?
It's a really good question, actually, because people bandy about the word net zero carbon, and there are different definitions out there. So, as I said before, we're a signatory to the Green Building Council, and we've used their different definition effectively. So, what they do is they split the definition into 2 elements. So, the first one is embodied carbon, and the second one is operational carbon. So what do we mean by embodied carbon? Well, it's the amount of carbon associated with the actual construction of the building and the processes involved in that. And then operational carbon is once the building's up and running, what's the carbon associated with that ongoing use of the building? So, it's energy demands effectively.
And what can you do then to specifically reduce? If you split those down to embodied carbon and operational carbon, do they fall into very different categories, to-do lists, if you like?
They do. What we do is we follow a methodical approach. So first of all, we look at embodied carbon. So how can we use materials that have lower carbon emissions associated with them? And then we look at operational carbon. How can we design and construct the building to minimize its energy demands? After we've done that, we look at renewables, so putting PV on the roof, and then finally offsetting. But in terms of embodied carbon, essentially it's down to the materials we use. And what we found is the biggest element of any development really is the structure. So what materials have the lowest carbon? What we found is using timber is a good way of starting off. So timber frame or cross-laminated timber, CLT, seems to have the biggest effect and move the dial. But what we're doing is keeping quite an open mind on it, because sometimes we'd like to use steel. It's more flexible, but perhaps at some point we'll have some recycled steel. There is recycled steel available, but it needs shipping from Europe, so that's not particularly environmentally friendly. So that's on the embodied side. And then on the operational side of things, there are a few things you can do without necessarily increasing costs. So the orientation of the building, making sure that's right so that you're optimizing the temperature curve. We look at fenestration, so windows, have smaller windows on the south elevation, for example. We might have deeper reveals so that the windows are inset, so there's more shadowing, and of course better insulation. So there's a basket of things we can look at for any one development.
I just was looking slightly distracted while you were talking, so I was looking at the questions that were coming in. And Sarah says, can I ask that for properties that are not owned by the NHS, how is good practice being shared? I just wondered, Ashley, if you've got any insight into that, all the learnings you've got.
Yeah, I mean, we're a publicly listed FTSE 250 company. We have a sort of, and we publish information on this. And as I said before about the Green Building Council, we have to publish everything. We have a strategy for both our existing estate and also our new developments. So we own about 645 medical centres, I think it was the last count. So we're having a strategy for that. And we've published information on how we're upgrading various existing properties to EPC Band B, and then becoming net zero by 2030. And then for the new development side of things, we're often sharing information with the NHS and publicly. So it is out there. And
Cameron, Dan's asking, is there a central hub where people can share ideas and updates on tackling climate change adaptation? I wonder if you, Cameron, or Ali, have come across a central hub that would be useful for our audience.
Yes, there's a couple, and I'll hand over to Ali in a minute if I don't cover it all. But there's the Greener NHS has actually got some excellent material out there, etc. at the moment, and there's the NHS Estates Forum as well. That has a Greener NHS aspect on that. So they're the two places that I would recommend. It's a great knowledge sharing aspect if people have different questions. We put one up there recently around heat metering and those sorts of aspects to see what challenges others trusts have come across. And there's a wealth of information out there. It's just trying to find the right people with it, I think, is the main one. But they would be the two places I would recommend to start with.
Great. Do you need to add to that, Ali? Have you got anywhere else that you can point people to?
No, I mean, Greener NHS is my go-to, and just to come back to non-NHS organisations, we connect in with the Thames Valley Chamber of Commerce, for example. So they try and work with businesses, and there's local business networks that we make sure we connect in with them, and they're trying to connect with each other. And if we can help share some of the stuff from the Greener NHS, which we sometimes do, that's really helpful as well. But there's lots of business networks out there that are trying to share and learn from each other. I think it's important.
Cameron, just going back to you, following on from what Ashley was saying, how is net zero different from what NHS PS has already been doing to reduce carbon emissions?
It's been really interesting, actually. I've sort of been in this sort of career for 20 odd years, and very much over that time, it's been fascinating seeing the transition that's gone through in terms of it was very much around how much money can we save in terms of our utilities. That was very much how my career started, etc. And for a very long time, that was the primary focus of whether it was the clients I was working with or the customers I had. So it was. It's then slowly developed in terms of as the carbon element has really started to develop over the years, and the recent introduction or that change to decarbonisation, that focus there is previously we'd approach a building and it would be, right, how can we make this more efficient? So, for example, if there was a boiler in the building, it would be, right, what insulation can we put on it? What better controls can we put on it? If that boiler was coming to the end of the life, can we put a more efficient boiler in? And there may be some projects that we wouldn't really consider because we were guided by a business case study. Like, quite often it would be maybe a 2-year or a 5-year payback that we had to sort of comply with. And so that ruled out a lot of things around like insulation, for example. Now this conversation is moving from that energy efficiency aspect to decarbonisation. It's no longer what can we do with that gas boiler. It is how do we remove that gas boiler. And so instead of it just being, let's get some, tweak some efficiency, is we need to do a fundamental change of the infrastructure that is here. So that opens up all sorts of challenges. It then opens up the scope as well, in terms of now when we approach, say, a roof replacement, where it would be around in terms of what's the best material, long lasting, lowest maintenance for its life cycle, is now what else can we do with that? Can we put more insulation in? Can we make that roof ready for maybe a solar insulation? Can we put in a membrane that actually improves the air quality, which we've done at one of our health centres, picking up the nitrous oxides and making that air cleaner in the local area. So it's now actually expanding that scope and making the conversation more, instead of that commercial aspect, in terms of, right, well, we've got this decarbonisation goal, we need to remove gas, we've got to leave the dinosaurs in the ground where they've been for many millions of years, and finding alternative ways of being able to actually supply that heating or that backlog maintenance that we were used to. So it's quite a fundamental change in terms of mindset for us. But an exciting one, because it opens up so many more opportunities and aspects that we can now try and help clean up the NHS and help.
And Ali, as you're building Berkshire together, Cameron mentioned challenges there. Are there any dependencies to achieving your very ambitious net zero carbon target, as you mentioned earlier now, that you're particularly worried about, or anything that's keeping you awake at night? What are the main challenges you're trying to tackle?
Certainly with the new hospitals, we're one of the hospitals on the new hospital programme, and we still don't have certainty around funding, which could change the direction of whether we build or redevelop on site, or what we get on site. So it's really difficult to know without understanding the funding envelope, which we probably won't know for another year or so. That said, we kind of are working on these, we'd have to do this anyway, so what can we do regardless? So we are trying to, and we're setting up engagement sessions with the university and some experts to help us with our problem. But our biggest challenge is, if we have to redevelop on site, it's reducing, while we're building something that might be net zero, we're also emitting quite a lot of CO2 while we're in construction. So that's a real challenge actually for us, and we're hoping that modular builds will help with that, to build off-site and to bring it on site, but that has its own challenges with travel and all of that sort of stuff. But our own scope 1 and 2 will be massively helped with the modular builds and modern methods of construction, we think, going forward. But again, that comes down to the funding we get for the building.
Ashley, what about you? What are your biggest challenges?
Many challenges. I mean, if you had a blank piece of paper to design a new medical centre that was going to be net zero carbon, it wouldn't be too complicated, I don't think. But this is never straightforward, and there's never the perfect site. So it might be a funny shape, it might be sloped, it might be facing the wrong way for patient access. Plus, there's a tug of war on the design between various stakeholders, so the planners, the GPs, the NHS, local residents, politicians, all want different things potentially, and that might conflict with how you want to design the perfect net zero carbon building. So that's one aspect, and then another big factor is procurement. So when we're delivering these buildings, there are many parties within that supply chain. So we will employ a main contractor. They will subcontract. There will be suppliers. And are they all aligned on net zero carbon? Do they all have the skills and expertise to deliver what we in the NHS want? So procurement's an issue. Cost obviously has been mentioned by Alison as well. Of course, that's the elephant in the room. Who pays for it all, especially if there's going to be offsetting? And then availability of materials. So you might have this great idea. You want to use cross-laminated timber, but it might not be. It might be extremely expensive to get hold of, or there might be supply chain shortages. So that's another challenge. And then there's things like insurance we need to think about. So if you think about timber, it's a combustible material, so it's not ideal. I mean, it has been used for centuries, so we can still build with it, but the insurers don't particularly like it. So we're working with the likes of AXA and Chubb to satisfy them and make sure they're on the journey with us as well. And then probably the final thing I would say is from an NHS development point of view, there's probably at the moment there's a little bit of a lack of guidance. So we do hear that they want net zero carbon, and we might be talking to a CCG about it. But when we probe a bit further, they're not sure exactly what they mean by it. Do they mean operational only? What is their policy on offsetting? So some clarity on NHS guidance would be amazing going forward. But it is early days, of course.
Just a quick question for you, Ashley, from Alexander. Alexander says, what controls do you use with contractors on how they deal with waste, i.e. recycling items, rather than putting into a general waste skip?
Yes, I mean, this is part of, I mean, we already do that as part of our BREEAM. So we get, so BREEAM is a sustainability tool, and you get certain points for things like waste disposal and recycling. So that is already considered. I don't particularly get involved in that construction aspect, but when we are inviting contractors to tender, we will be looking at all their credentials, whether they're considerate contractor, accredited, and so on. So it's something we definitely look at and score, and it's one small element of the bigger picture.
A question from Loredana for Cameron. What is NHS Property Services doing about active air purification methods that create extra layers of indoor protection beyond ventilation, etc., and are proven to cause acquired infection rates in hospitals and care homes to drop through the floor?
Big question.
It's a question, actually, isn't it?
So in terms of it, it's a really interesting one when you start to map out the air quality, etc., like that associated with where a lot of our centres are located. Predominantly for us, it's that what green space is actually available. We're trying to work out in terms of how that biodiversity element comes in. But in terms of meeting regulations, etc., like that typically comes down to the air handling units and the filtration that we put in on that side of things. There is that's your primary one. That's where the majority of those aspects come through. What we're attempting to do going forward is increasing that greener space, etc., like that. There's actually quite a lot of particulate filtration that actually happens with trees, if you can get those through between road space. And we have actually at one of our sites actually gone through and put on a flat roof section, we installed a membrane there that actually interacts with nitrous oxide and then actually makes it into an inert particle that then can be washed away as part of normal rainwater. So it's a one that there's not one answer to. I wish there was a silver bullet to like for any of these things. I wish there was. It's just all those small steps you go in. But the primary one is that making sure that we've got that proper filtration on our air handling units.
And Cameron, if there was one innovation or one piece of change that you think is going to have the biggest impact on your progress and what you're trying to achieve, what would that be, do you think?
Picking one is probably the first challenge on that. I think just picking up on terms of a couple of the points that Alison and Ashley raised is we've got quite a large historical estate. So Ashley was saying in terms of if you've got a new build, then you've got a clean slate to be able to go with it. And then picking up on Alison's points in terms of financing, being able to retrofit some of these solutions, I think, is going to be the real challenges. They're cost effective if they're in a new build, but being able to replace potentially steam, heating plant that was built many years ago to operate on steam. A lot of the technology is not the net zero carbon technology is not designed to be able to work at those high temperatures. So I think there will be, from my side of things, there's if we can get a high temperature heat pump that's cost effective to both to run and install. I think that will go a long way. I'm really hoping that comes with a inert refrigerant as well. I do have concerns about the global warming potential of all this new refrigerant that might be going in terms of heat pumps. And then it'll be interesting to see whether actually hydrogen actually comes in, and that may be an interim solution in terms of it helping us reduce that sort of reliance on gas and reducing its carbon footprint. And that may actually develop to the point where it is actually cost effective as a solution for some of our larger sites to be just a pure energy source. But I think it's the combination of those two is how can we actually get a high temperature, renewable net zero carbon energy source or heat source for our buildings.
Ali, I'd love your thoughts on that too. And then I was going to ask you about, how is your organisation is funded actually? Let's talk about the elephant in the room, funding to make all this kind of thing happen. But do you want to follow on from what Cameron was saying there?
I mean, I would agree in terms of, and that's half our emissions are, the heats, and I think I would agree with that. There's something as well about sort of help making it easier to turn things off. We're just finding that, overnight we probably don't save as, save as much energy overnight as we could do. There's not a massive difference between what we're using during the day and what, that you would expect. So, how do we automatically switch things off in the same way as you walk into a room and you have to wave your hands to turn the lights on or what have you? How do you, the innovations that make it automated, that it turns things off? I think that would really help with some of our energy and electricity use. We've got a whole range of, we've got multiple ways of gathering ideas. So we've got things that come in from our carbon champions. We've got things that come through the green network and our integrated care system. And we have like a pipeline where we process, we have a group of people who look through, what's low cost, what's low hanging fruit, what investment. And you've asked the question around investment. So, if there's a business case there, which there clearly was for de-steaming, we were able to apply for national funding for that. So we were successful in applying and getting that funding. We are joining up with our university and with the integrated care partnership, integrated system, to get ready for the PSDS funding, so that we're ready with bids, so that, so we're not all doing it separately, and things that would benefit people who who are close to us, like the university, looking at district heat pumps that we might be able to share with them, and making some joint bids. So it's a bit of trust investment, a bit of external funding. We are looking as well in the future at things like, if we do have innovations, looking at corporate sponsorship. So there has been some interest in corporate sponsorship. So carbon moss on the outside of walls. Some organisations are keen to sponsor that if they can have their logo on that, saying given by whichever company it is, and solar panels, things like that. So there are opportunities to work with corporate organisations who want to do something for the NHS as well.
There's so much exciting stuff going on there, Ashley. One thing, of course, though, is future-proofing, isn't it? When you're at the cutting edge of design and designing, net zero community centres or buildings or hospital buildings, is there a nervousness around, I've noticed it personally in the airport sector, there's a bit of a paralysis to get cracking. You sound like you've all got cracking brilliantly, but is future-proofing always at the back of your mind? Cameron dropped in hydrogen there. We're all going for electric cars at the minute, electric chargers, but, in a few years' time, are we going to have hydrogen cars? How do you strike that balance between needing to get started and make a difference, but also bearing in mind that technology is changing and innovation is changing very quickly?
Yeah, I think we're in a quite good position because we're a fund and we can take a really long-term view. So all our tenants have long leases. When we are taking new development schemes and new acquisitions to our investment committee, sustainability is a key part of that, along with social impact. So we're always looking for long-term, how sustainable is this building? Are they, at the end of 25 years, are they going to be able to renew another 25 years? So we're always thinking about flexibility and longevity. I think we were one of the first developers to put in an expansion space into a building, for example, which is something we noticed with some older NHS PS buildings or NHS buildings. They were built and they didn't have the capacity to expand. So we're always thinking 10, 20, 30 years ahead, trying to be as flexible. No one has a crystal ball, do they? But we're trying to think about the future and think about how things are powered as well. So yeah, it's a difficult one, but it's definitely at the forefront of our thinking.
Oh, it's definitely one you all seem very enthused about and passionate. I'm just going to squeeze, we've only got 20 seconds, Cameron, but a quick question from Adam. He says he follows very closely to Cameron's point on retrofitting net zero carbon technologies. The technologies have a very long financial payback period. Will you have to change your funding model on trust estates to be more flexible, using more abstract metrics, perhaps considering the future cost savings associated with less pressure on the NHS due to the improved air quality? Just a quick answer to that. So we squeeze one more question in.
It's very similar to what Alison said. We've built a system that follows the structure of the PSDS in terms of being able to, when we're doing infrastructure changes for backlog maintenance, we've already got some capital invested associated with that. So being able to identify the uplift funding that's required to put in these low carbon technologies. So it's only that marginal cost element that we're having to invest in, and hopefully with that aspect, it's the increased efficiencies or the carbon savings associated with it justifies it as a project from that perspective.
Fantastic. Thank you very much. I can't believe how quickly that half hour went. Thank you so much to our first panelists, to Ashley, Ali and Cameron, for kicking off the day with a great discussion and some brilliant insights. And thank you to you as well for putting so many questions in. I think there's one, two that I didn't get to, but I'm sure the team behind the scenes at NHE will put those questions to our panelists privately for you. We'll take a quick break now. It's time to digest what's been covered so far. And if you have chance, do engage with the speed networking functionality. Perhaps use what you've learned so far as a bit of an icebreaker. Let's meet back here at 10:40.